Is IPL safe to have done for severe cystic acne?
Thank you for your question. You're asking if IPL is safe for severe cystic acne. Well, certainly it's a very straightforward question, but unfortunately acne is a complex problem, particularly when you're talking about cystic acne. A little bit of background about myself. I'm a board-certified cosmetic surgeon, fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Cosmetic dermatology is a very significant part of the services that we offer in our practice, and solving problems related to acne, although it's not focused on teenagers but more with adults with acne, is something we've been dealing with for this entire time. And I can tell you that there are a lot of ways to approach acne, but we'll address this question specifically. First, it's actually relatively recent, let's say in the past 5 to 10 years, that the idea of light-based therapy for acne became more popular. And it was based on the idea of essentially trying to treat the bacteria called Propionibacterium acnes that is within what's called the pilosebaceous unit, that is a bacteria that is associated with the inflammation causing acne, as well as other modalities such as reducing the blood supply, the vessels that are contributing to the acne, as well as the inflammation. So when you think of IPL, IPL stands for intense pulse light. Intense pulse light means there are many different wavelengths that are filtered so that it's not like a laser where a laser is a single wavelength. IPL is multiple wavelengths. And within that particular device, you can put on different handpieces which filter different wavelengths to help treat particular target tissues. So IPL may be reasonably safe enough for cystic acne, but the question is it the best light energy based device for the treatment of acne? And this is where a lot of doctors will conflict about this type of situation. To begin with, when you're dealing with cystic acne, you have to think about management from a systemic level as well as the topical or treatment level with an external device. So generally, one would consider oral antibiotics, drugs such as doxycycline, as well as the use of steroid injection, which means to treat the acne directly, not to mention that in some cases you want to do incision or opening and manual expression of the keratin plug within the acne lesion. And then on top of that, if you want to think about a light energy device, I'll share with you how I decided to choose the one that I use in my practice. I've had several different intense pulse light machines over the many years that this technology has been around. And one of the challenges I've always dealt with is the amount of controlling the amount of heat that was being applied to the skin. And even when I would use cooling gel and pre-cool the skin with not only a gel but then with these cold packs and cold rollers to protect the superficial skin so that the therapeutic energy would be delivered deeper, the skin still had a tendency to get heated up. So I decided ultimately to go with a laser that is called an ND-YAG laser. And what essentially is it's a laser that allows me to treat the acne without having to do this level of pre-cooling. We still can cool the skin, but the point is that I feel it's more convenient for the patient, it's safer in terms of the amount of heat being delivered to the skin, and in the end it is just much easier for the patient to tolerate. And instead of having to deal with some redness afterwards and dealing with that issue if we can avoid it. So in my practice, I use an Nd:YAG, a very specific type of Nd:YAG laser with a particular type of method and treatment plan. But I would say that it's part of a treatment plan. It's not just the only thing we do. So the answer to your question is IPL safe for cystic acne? It can be, but you should meet with doctors who have experience using light-based energy devices, learn about why they choose their particular device and why they feel like that's the better choice, and see what works for you. These decisions are made a lot based on also skin type, the age, the type of acne, and many other factors that are beyond just this simple question. So again, meet with doctors, learn about your options, and see where does a light-based energy device fit with the treatment of your acne. So I hope that was helpful, and I wish you the best of luck. And thank you for your question.